just curious about how it flows through your practice, how you kind of, have it incorporated.
Yeah. Again, another good question. For me, initially, it was more selective.
Hmm.
When patients would, when they found out that I do Shockwave, they would come in. They have plantar fasciitis or elbow issues or shoulder issues, what have you. But very quickly, and initially when we started with using the Shockwave, we started using it internally with our own patients. So right off the get go, it was something that patients did not know about, and we were introducing them to this technology and wanting to let them know that these conditions that we're treating you for chiropractically, now we're going to introduce this additional modality that we're going to use in conjunction to deal with the stuff that we may not be able to break up, because everybody knows any chiropractor that's been around, one of the most problematic type of thing is chronicity. So if we're able to break that up, and that's how we approach the patient, besides we just kind of put them in the study, we said, well, we're going to do this. We're going to start you off with this at the same time that we're doing your Shockwave, well, your chiropractic.
Hmm.
So there's options right now in my practice where patient comes in for Shockwave, then that's all they want. That's all they get. However, there's a lot of times when, and I do very specific type of chiropractic work with x-rays and the whole analysis and functional x-rays along with static x-rays, where I tell the patient, I think that your plantar fasciitis is not only because of your, it's not only because of your, flat feet or pronation at your feet, but also you have a hip issue where it's externally rotated. So, and also your joint is locked up. So why shouldn't, or what I would recommend is, why don't we combine the chiropractic along with the Shockwave, and you'll find a lot more benefits from it, and it'll last longer. So it's both, to answer your questions, is not only, and I found the Shockwave very extensively embedded in my practice and a lot with my patients. And a lot of times, once they experience it, once they see what it does and how effective it is, along with what I do as a chiropractor, inevitably they always want to have the Shockwave done in another area. So if they have the feet done, they'd say, "Hey, by the way, I have this injury in my shoulder. Can we use it on the shoulder?" Yeah, of course. But I have golfers that they want it to be used on their golfers elbow, and it's like that they're amazed about how much that condition changes and how much improvement they get. So yeah, it's both actually.
That's awesome, man. I mean,